Good evening, and thank you for attending Building Your Toolbox, a monthly educational series where practitioners teach individuals a pain management strategy or skill. Tonight, we are joined by guest presenter, Dr. Jason Winkelmann, who will be discussing the fundamentals of gut health and chronic pain. My name is Michelle Rice. I have lived with chronic pain for over 23 years and serve as the patient engagement lead for the U.S. Pain Foundation. Joining me tonight is Bobby Blades, a longtime volunteer support group leader for the organization. The U.S. Pain Foundation is committed to improving the lives of people with pain. Our mission to empower, educate, connect, and advocate for all individuals, kids, and adults living with chronic illnesses or serious injuries that cause pain, as well as their caregivers and clinicians. Recognizing that nearly every chronic condition has a pain component, our network is extensive. We are dedicated to making sure everyone, communities of color, people living in rural areas, LGBTQ+ communities, military members and veterans, seniors, pediatric population, and caregivers or care persons has equitable access to healthcare. We currently have a mailing list of over 31,000 and followers on social media of 230,000. We strongly believe in the power of numbers and collaborating with like-minded groups. We are a member of many coalitions and partner with other nonprofit organizations to amplify the patient voice and improve overall health outcomes for the more than 51 million Americans living with chronic pain. The organization develops free programs and services to help individuals. Our programs include a national network of support groups, educational resources and events, a pediatric program for children and families, advocacy efforts, an awareness magazine called The Invisible Project, and more. To learn more or how to get involved, please visit us at uspainfoundation.org. Here is our agenda for this evening. After reviewing a few housekeeping items, we will introduce our guest presenter, Dr. Jason Winkelmann. Tonight's topic will focus on gut health and pain. What is leaky gut and how to fix it? How leaky gut is the greatest source of chronic inflammation? How leaky gut contributes to autoimmune disease and chronic pain? Why biochemical pain is worse than physical pain? And best anti-inflammatory practices. Following the discussion, we will open it up to question and answers. With that, I am now going to ask Bobby to share more about the logistics for tonight.
Hi, everyone. Thanks for joining us. So participants are on mute for the first portion of the event, and questions will be taken at the end. At that point, we won't be recording when we're at the question part. During Q&A, please raise your hand through the icon at the bottom of your Zoom screen. On mine, it is called reactions. If you would click on that, you'll see a raise hand and then a lower hand. Please keep your questions on topic as much as possible. If responding to another participant, be careful not to rescue or give advice. We're here to validate and support. And remember, different treatments work differently for everyone. Be respectful of other opinions. Please remute yourself once you're done speaking. Next slide. And the disclaimer is tonight's event is educational only. The information is not meant to take the place of your healthcare provider. You should always consult with your practitioner about your unique healthcare situation. U.S. Pain Foundation does not recommend or endorse any one therapy, treatment, or product. If you feel that your medical conditions are adversely affected by your participation in this webinar, It is your responsibility to discontinue participation and to immediately consult with your healthcare provider. Thank you.
Okay,
Back to you.
I
Back to
have
you,
the
Michelle.
distinct privilege of introducing our guest presenter this evening. Dr. Jason Winkelmann is a naturopathic doctor and a chiropractor in the Denver metropolitan area. Treating chronic pain has become Dr. Winkelmann's purpose and mission. He works with all patient demographics and types of chronic pain, no matter how long someone has been living with pain or how severe. He specializes in treating chronic pain naturally without the use of medications, injections, or procedures. You can find him at his clinic, True Health Natural Pain Center in Northern Denver. Dr. Winkelmann, we are so excited to have you speak tonight about gut health, and thank you for being here.
Hey, thank you, Michelle. Really happy to be here.
Thank you, Michelle.
Nicole, are you still there?
All right. Good to go?
We do not see your slides yet.
Not yet?
No, but I think it says that we're still viewing Nicole's screen.
Okay. My screen says I'm sharing, so.
There we go.
Yeah?
Yes, we can see it now.
Awesome.
Perfect.
All
Thank you.
right. Thank you, Michelle and Bobby, and thank you all so much for joining me today. Gut health, super important to me because its relation to chronic pain is undeniable. It doesn't seem that a lot of people are addressing it, so I kind of hope that you already know its importance, but at the same time, I really hope that you learned something new today. So get started. It doesn't matter what the source of your chronic pain is. Pain is a physical, a biochemical, and a mental emotional process. And in order to properly treat chronic pain, you have to treat all of those fronts. And unfortunately, the treatments that a lot of these chronic pain sufferers get don't focus on all of them. They usually just focus on one. Like PT or chiropractic work is pretty much just focusing on the physical, pain meds, injections, just working on the biochemical. But even these top tier chronic pain clinics don't address all three things. And until you do, you're just not going to get out of your chronic pain. I wish I could talk about all of them today, but for the focus of today, it's just going to be on the biochemical aspect, particularly gut health and its contribution to chronic inflammation. So before we talk about what leaky gut is, we first have to know what normal digestion looks like. Normal digestion begins with the sight and the smell of food. Because when you see and smell something that looks tasty, what happens? Your mouth waters, you start to salivate. And saliva contains immunoglobulins that help combat viruses or bacteria that you ingest, but also contains digestive enzymes like amylase to help break down your food. The next thing is chewing. Chewing is actually what stimulates your stomach to secrete hydrochloric acid, stomach acid, HCl. So if you're not chewing properly, or if you're like on a liquid diet, you're not going to stimulate enough digestive enzymes and HCl to actually help break down the food. Because you have to remember, food is nutrients. It's not just fuel that's just getting you through the day and filling your stomach. It's nutrients that helps actually heal damaged tissues. And we need to get that food into its most usable form and able to do so. So after you swallow, food goes down your esophagus and it hits your lower esophageal sphincter, which is right between your esophagus and your stomach. And that sphincter is like, we're going to view it as a little flap. So when the food hits it, it goes down, food goes into your stomach, flap goes back up, and that way the food can't get back into your esophagus. For people with heartburn, GERD, reflux, that's because that sphincter is staying down and all that stomach acid is able to come back up into the esophagus. And because it's acidic, it burns. So what happens? You go to your doctor, they give you omeprazole, acid blockers, proton pump inhibitors, things to prevent acid secretion and to make the acid more alkaline, more basic. But that lower esophageal sphincter, its feedback mechanism to close is stomach acid. If you don't have enough stomach acid, it doesn't close, and therefore everything comes back up. And if you're taking any of those drugs, you're still getting the reflux. It just doesn't burn because it's more basic, but it's still doing damage. So for most people who have reflux, heartburn, GERD, really what they need is more acid to close that sphincter. So now that the food is in your stomach, the stomach churns to kind of mix up the food with the acid so that the acid can break down the food into its smallest, most usable forms. Once it's done a good enough job at that, empties the food into your small intestine. The very first thing is your gallbladder underneath your liver here releases bile, which helps emulsify fats to break them down and make them more digestible. Then your pancreas, which hides behind your stomach, releases digestive enzymes to help break down your food even further. Things like amylase, protease, and lipase to help break down carbs, protein, and fat. All that food then works its way through your small intestines. The small intestine's job is to absorb as many nutrients as possible from your food. All that food then makes its way into your large intestine where all the water is absorbed. Then all that food can be compacted into your feces where they go up, over, down, and then you eliminate them. So that's proper digestion. So what is leaky gut? Leaky gut, this lovely definition, is a hypothetical condition that's not currently recognized as a medical diagnosis. It's based on the concept of increased intestinal permeability, which occurs in some gastrointestinal diseases, brought to you by the fine folks at the Cleveland Clinic. So they think it doesn't exist, so talk over, I guess. Unfortunately, leaky gut is a very real condition, and it is a big driver of chronic pain and inflammation for people. And when we have these big clinics like Cleveland and Mayo and Johns Hopkins, who we look to and rely to get the best information on treating our chronic pain and diseases, and they don't even understand certain drivers of conditions, this is why treatments suffer a lot of the times. So to fully understand leaky gut, we first have to look at what a normal, healthy small intestine looks like on the left here. Think of your small intestine as like a sausage casing. It's really thin. It's only one cell wall thick. We call those cells enterocytes, these small intestinal cells. These enterocytes are held together by tight junctions. They hold the cells together really tightly so that things can't get through. What happens is these little hairs on top of the cells grab onto food particles, and those food particles make their way through the cell where they're broken down even further and put into the bloodstream, where they're then shuttled and transported around the body to help fuel your body and heal damaged tissues. Leaky gut, on the other hand, is when we lose the integrity of those tight junctions and those cells start to separate. Now things that previously couldn't get through are now making their way in between all of the cells. And this is a bad, bad thing. But actually, leaky gut is a normal physiological process. But why would we ever want to lose that integrity? See, there's a protein called zonulin that breaks down those tight junctions and allows permeability between those enterocytes, those small intestinal cells. And it does so to actually allow pathogens into your bloodstream, which sounds crazy. But when we ingest a virus or a bacteria, if it's in your intestines, it can do harm. your immune system can't get to viruses and bacteria in your gut because the immune system lives in the blood cell, in your bloodstream. So zonulin breaks down those tight junctions in the presence of pathogens to allow the pathogens through in between the cells into the bloodstream where your immune system can attack them. That's great. Except for we also have pathological leaky gut because those tight junctions don't always close back up. And now things that shouldn't be getting into the bloodstream get in. And there's two main causes of pathological leaky gut, chemical and physical. The chemical cause is mainly through gluten. Everyone's probably heard the word gluten, but maybe not familiar with exactly what it is. It's a protein found in wheat, barley, and rye, mainly, which sounds crazy because we always think of proteins as good things. But gluten will break the tight junctions of those enterocytes. And 100% of people who consume gluten have intestinal permeability, leaky gut to some extent, whether they know it or not, whether they feel the effects of it or not. Then there's also the physical. Well, I need to go back and talk about why gluten is so dangerous. Wheat, way back in the day, used to only be this tall and have this much gluten in it. We had no problems with it. It didn't do any harm. But we have a bad habit of ruining all of our food in this country. And bakers realized that gluten is what made their doughs really sticky and delectable, and they could bake more things with it. So they started working with the farmers to hybridize the wheat. And now wheat is way tall and has this much gluten in it, and we can't handle it anymore. And in combination with all the glyphosates, insecticides, herbicides that we throw on top of our wheat, it amplifies the toxic effects of that gluten. Now the physical, and this primarily comes through inflammation. So when you eat inflammatory foods like dairy, sugar, or any food sensitivities that you may have, inflammation builds up in the gut and it actually starts to remodel the cells. Think about if you sprain your ankle and it blows up really big. It's distorting all of those tissues and it's doing the same thing to your intestine. It pushes on those cells and they have nowhere to go, so they have to stretch and open to accommodate all that inflammation. That pushes the cells apart, and now things that shouldn't be getting into the bloodstream now can, including food that's too big and not fully digested. So the reason, now we already have one inflammatory effect from the food that you're eating, but now the leaky gut causes a secondary inflammation. And this is because those non-food particles can get into your bloodstream. Even if it is food, it hasn't been broken down far enough into usable nutrients for your body. And it doesn't actually look like food. So when it gets into your bloodstream, your immune system kind of tags it and says, well, this looks like food, but it's not the food that I'm used to. I think it's bad. And the first line of defense is to take that food out of your bloodstream and put it somewhere else. And it's always going to put it into good, healthy tissues for storage. A common place is your adipose tissue, your fat cells. But like gluten will almost always go to your thyroid gland. Now the next line of defense in your immune system has to get rid of all that stuff. So it comes in and it acts kind of like an oncologist cutting out a tumor. See, if you're an oncologist, you're trying to cut a tumor out, you wouldn't cut gently along the line of the tumor. You would take a little bit extra just to be careful, just to make sure you got it all. But in doing so, you're inevitably damaging good, healthy tissues, which causes a secondary inflammatory response. And as long as you are constantly consuming all of those foods like dairy, gluten, sugars, you have leaky gut, you have inflammation, the antibodies are going to keep being on patrol. Those antibodies become autoantibodies because now they're actually attacking good, healthy tissue, producing more and more inflammation. And this is actually the cause of almost every autoimmune disease out there. It always starts in the gut. So to understand inflammation a little bit more, two types, acute and chronic. Acute inflammation is injury related. Again, this is like you sprain your ankle and it blows up really big. The point of that is to help stabilize the joint so that you don't move it. It causes pain to alert you, say, hey, let's stop putting pressure on this ankle. Let's stop moving it in that direction. But it also draws more blood and inflammation to the area. See, acute inflammation, as annoying and painful as it is actually very beneficial. It has a point. It's trying to help heal damaged tissues. But then we have chronic inflammation, and chronic inflammation is non-injury related. It's low grade, it's systemic, meaning it's all over your body and it's going to travel throughout your body. And we can't see it and we can't feel it. And there's not a lot of good tests for it as well, at least tests that your primary care physicians and non-specialists are aware of and ordering for you. But chronic inflammation doesn't have a purpose. It only causes damage. It doesn't do any good. And this is a big issue, especially in chronic pain. To understand inflammation a little bit more, we have two primary inflammatory pathways. The first is the acute, the arachidonic acid pathway. Arachidonic acid will eventually turn into thromboxanes, which produce platelets, the things in your blood that help coagulate your blood. So when you cut yourself, you don't just bleed until there's no more blood left. Prostacyclins, which protect the endothelium, that's the inside lining of your blood vessels. And it produces prostaglandins, which are responsible for inflammation. So the swelling, the pain, the redness, the heat, all those things that come with inflammation. And this is why they recommend giving aspirin and NSAIDs, non-steroidal anti-inflammatory drugs, for injury and pain. It's because it shuts down this pathway here. The problem is it shuts down everything. So you lose the platelets, you start to get endothelial damage because you don't longer have that integrity to your blood vessels. And this is why aspirin used to be recommended as a daily thing to help prevent heart attacks because it thinned out your blood. We have since disproven that that is a good idea. If your doctor still recommends aspirin for heart attacks, you need to have a talk with them. So this kind of works for acute cases because it just makes you feel a little bit better, but it doesn't actually help heal any of the tissues. And it can cause things like heart attacks and strokes because it's damaging blood vessels. So it's supposed to be helping, but then it doesn't help. In the case of chronic pain, this is why NSAIDs just don't work at all, and they cause more harm than good. The chronic inflammatory pathway is called the nuclear factor kappa beta pathway. It is a big, complicated mess, so I'm not even going to try to get into it today. But what you need to know is the driver of this pathway is leaky gut syndrome, intestinal permeability. So we've got the biochemical pain, the physical pain, then the mental emotional pain. Biochemical pain, in my opinion, is always worse than physical pain. And that's because the body is really good at healing itself after injury. You can snap your femur in half. That's your thigh bone, the biggest, strongest muscle in your body. As long as you don't move that, you stabilize that joint or that bone, put a cast on it, you don't have to do anything else. Your body will heal that bone in 6 weeks and you'll be walking again. It's amazing. And you know pain is physical, not just because you injured yourself, but because that pain is intermittent. It comes and goes. It's here with certain movements and certain activities, but then usually at rest, it doesn't bother you. Biochemical pain, on the other hand, is worse because that pain is constant. If your pain never goes away, you know it's being driven by a biochemical factor, mainly inflammation. And once again, chronic inflammation is not something the body is actively trying to get rid of. It's just there causing damage behind the scenes. and inflammation is the root of all chronic pain and disease. Little side note, leaky gut causes leaky brain. How fun. You have a blood-brain barrier, which is this like ultra filter that only allows certain nutrients and water into your brain and keeps everything out, because we need to protect your brain at all costs. But when you have leaky gut, it breaks down that blood-brain barrier, and now toxins can get into your brain, which causes inflammation. And inflammation in the brain is the cause of almost any neurological condition, including dementia, Alzheimer's, depression, and anxiety. There's almost no chronic pain patients of mine that I see that don't have some degree of depression and anxiety. And it's not just because of the pain, it's because of the inflammatory effects that are happening on the brain. I've also written how dementia is super common in chronic pain because of that chronic inflammatory response. And then dementia oftentimes leads to Alzheimer's. So I know that was really fast. A lot about what causes leaky gut, but now there's some things that you can do. The first is address your eating habits. When we eat, we want to be in a parasympathetic state. So you have your autonomic nervous system, which is broken down into the sympathetics, which are your fight or flight response, and then your parasympathetics, which is your rest and digest response. So naturally, we want to be in the parasympathetic state when we're eating to extract the most amount of nutrients from our food as possible. Because remember, nutrients is what helps heal damaged tissues. So if we are in a calm environment, slow down when you eat, put your fork down, spoon down before bite or in between bites, and then chew thoroughly to stimulate the most stomach acid and digestive enzymes possible. We have a bad habit of eating in a rush and eating in stressful situations. We're trying to eat in the car, in traffic. We have too short of lunch breaks, and we're just not getting the full benefits of our food. And food's expensive enough to not get the most from it. The next thing is we have to work on the diets. And it's unfortunate, but you have to eliminate dairy, gluten, processed sugars, and any other known food sensitivities that you have. I highly recommend that everyone gets a good food sensitivity test, because there's always weird things out there that you're not aware of that are actually causing an inflammatory response in your body. When it comes to dairy, it's not just lactose intolerance. There's two primary proteins found in dairy called whey and casein, and both are very inflammatory to humans. Have to remember, the point of cow's milk is to turn a baby cow into a big, full-size cow as quickly as possible. It's not really designed to be consumed by humans. Human breast milk looks very different than cow's milk. Gluten, we talked about that. 100% of people who consume gluten have intestinal permeability. And unfortunately, I've never seen someone get out of their chronic pain long-term and keep eating gluten. And then sugar, that's a big mess of activating cortisol, insulin resistance, reactive hypoglycemia, all causes mass inflammation. But things to incorporate: more fiber, especially from vegetables and root vegetables. Fiber helps slow down your digestive process so that you actually can absorb more nutrients in your small intestines. And it helps combat the inflammatory responses of sugar and glucose spikes. Eating more fermented foods is a great idea. This used to be a staple of our diets, but not so much anymore. Eating whole foods, this seems like a no-brainer, but this is the way that humans were designed. We evolved to eat food that was provided by the earth: vegetables, meat, fish, not processed packaged foods that don't have nutritional content to them. And then again, eat organic foods. So all the glyphosates, insecticides, herbicides aren't amplifying the toxic effects. Taking supplements, always a good idea. Yes, we want to be getting these nutrients from our foods, but sometimes it's not enough. So anti-inflammatories, fish oil works on the arachidonic acid pathway. It's basically nature's aspirin, NSAID. Wonderful anti-inflammatory. And then turmeric and resveratrol work on that nuclear factor kappa beta pathway to help combat chronic inflammation. You can get all of these through diet alone, but supplementing makes sure you ensures that you get a high dose serving so that you actually have good anti-inflammatories. Most people will be like, oh, I'm taking fish oil, but they're just not taking enough to actually have that anti-inflammatory effect. So highly recommend supplementing. Even with the best diets, some people might still have leaky gut because those enterocytes never close back up. The tight junctions never healed themselves. So L-glutamine helps heal those tight junctions. L-glutamine is an amino acid found in proteins. So great, eat more protein. But again, a nice high concentrated dose of that L-glutamine is going to help heal those tight junctions even faster to mitigate that inflammatory response. Supporting your microbiome, always a good idea. For every cell in the body, there are 10 bacteria. So that means we are 10 times more bacteria than we actually are human. So don't you want to have the right bacteria in your gut? Because bacteria are responsible for a lot of things, but mainly they're anti-inflammatory, and they help produce neurotransmitters like serotonin to help boost your mood. So taking probiotics, great idea. Eating fermented foods, wonderful. A lot of research out lately about Akkermansia, which is a specific strain of probiotics that's been shown to help heal leaky guts and other gut-related conditions. And then taking digestive enzymes will definitely not hurt. So something that your pancreas releases naturally, but sometimes our pancreases are a little sluggish and can use a little help to help break down that food into usable nutrients. Now, going dairy, gluten, processed sugar-free can be a hassle at first, but over time, you get used to it. It becomes a habit and a lifestyle. Then you realize how much better you feel not consuming them, and you don't want to go back. Those foods don't actually even feel delectable anymore. A lot of restaurants nowadays are actually really good about, catering to dietary needs, but it's still limited and not perfect. So the best way to ensure that you are going all that dairy, gluten, sugar-free is to prepare your own food. But I understand that not all of us are wizards in the kitchen, or maybe it's even too painful to even go out and get your own groceries. So there's some really good services to help you with this. Grocery delivery services like Instacart, Thrive Market, the Amazon Prime and Whole Foods collaboration. These will deliver fresh, whole, organic foods right to your doorstep. And then these meal kit services are great as well. You can go in and put in your dietary preferences, and they'll only send you meals that fit what you need. Some of these services will just send you food ready to be heated up and eaten, while others will send you all the ingredients with the foolproof instructions on how to prepare them yourselves. So if you're not great at cooking and want to get into it, this is a great way to actually learn how to do it for yourself. And it seems like it would be pricey, but they're actually very competitively priced, and they all really want your business too. So this is what I do. Start with like HelloFresh. They really want your business, so they're going to offer you a bunch of free meals just to sign up. Sign up, get your free meals, and then cook them, enjoy them, go on to the next service. Do the same thing there, and the next service, and the next service. And by the time you get up to Green Chef here, HelloFresh is really going to want your business back. They're going to send you coupons for free meals. So this is actually super cost effective to do it this way. And that's it. I know that was really quick, but I really hope you learned something and definitely wanted to save time for any questions.